Bronson Battle Creek Hospital recently designated a Level 3 trauma center. Michigan Department of Health and Human Services has done so after a thorough on-site review. What does all that mean? Well, we're going to find out right now as we chat with Dr. David Bartholomew, surgeon at Bronson Battle Creek. And Dr. Bartholomew, good morning to you.
Good morning.
So Level 3 Trauma Center, I mean, it sounds good, but what does that mean to us?
Well, what it means is that we've been approved by the state to act as a trauma center. That means patients will be diverted here for various types of trauma. I think in the end it means better care for our trauma patients in Calhoun County.
Are we going to build a helipad now?
Well, we've talked about that, and I think that's something that we'd sure like to do. However, it's kind of a work in progress.
How does this compare to where we were, say, yesterday?
Well, actually, how it works is the larger centers are Level 1. A Level 2 is still a pretty big center.
Mm-hmm.
Level 3 is a big center, but we share the trauma patients with Kalamazoo, which is our sister hospital, and they're a Level 1. So some of the more involved traumas will get those patients transferred over there, but we work on them here, and if they need to go to Kalamazoo for a higher level of care, they'll go there. So essentially, what it means is we've got an organized response based on criteria. And so we've been practicing really as a Level 3 for several years, but we're putting into place all the requirements by the health department.
It sounds to me like the regional cooperation, the fact that we're affiliated with Bronson Methodist Hospital in Kalamazoo, this is an area where we're seeing great benefit from that.
Oh, absolutely. They have a lot of resources, and they have a lot of experience as well. So we are able to use all that and provide excellent care for our patients from Calhoun County.
And I imagine, the shared records, everybody's on one network. You can communicate in the blink of an eye with colleagues one town over if you need to, or get special equipment.
Yeah, that's exactly right. For example, if somebody has head trauma, we're able to get a CT over here as the patient is being stabilized, and I can have a discussion with a trauma surgeon and a neurosurgeon over in Kalamazoo about that study. And, I think that just aids in getting people over quicker and safer, and they don't have to repeat any studies over there.
Now, I think our goal, Dr. Bartholomew, would be to not have to use our Level 3 trauma center. So I think the hospital agrees as they've invested in injury prevention programs.
Yeah, so we have quite a few injury prevention programs. I think the one that I always think of is, for example, the helmet. Reduced helmets are provided to our patients in Calhoun County at a reduced price, and so I think that's just another example of kind of how the Bronson system really wants to prevent injury rather than treat it after the fact.
What are some of the criteria that was looked at to determine whether we have a Level 3 trauma center or not?
Well, one of the more important things is you have to have availability of trauma surgeons for the more acutely injured patients.
Mm-hmm.
We need adequate facilities that patients can move through. We need a process by which patients are triaged, and then criteria that we use to determine the level of care that they require. And so the more acutely injured will come in as a Tier 1, such as a gunshot wound or a stab wound, or even a very severe car accident. And so when we have somebody that's designated that Tier 1, we'll have all the resources show up at one time. That includes radiology, trauma. The ED physicians are always there. And so we get labs. All this information is then provided up front. And it seems to really streamline the processing of patients.
And does this mean that also Bronson Battle Creek now is kind of like a big brother to, rural medical centers in Calhoun County and the surrounding area?
Yeah, absolutely. We see transfers from a lot of different smaller hospitals, and we partner with our other Bronson affiliates as well.
Well, it's pretty exciting news. Is this something that you and the staff at Bronson Battle Creek sat down and said, you know what, this is a goal of ours to be a level 3 trauma center?
Yeah, that's really what happened is we got together several years ago, and we determined that this would be a good thing for our community to become a officially designated trauma center. And so that's what we did is we worked on that. We looked at all the requirements, had multiple meetings as we do quite a bit here at hospitals, at the hospital rather, and a lot of meetings, but they were worth it. And so we were able to put together, kind of a plan of action, and we implemented it, and were able to succeed.
Well, congratulations, Dr. Bartholomew, and thank you very much for spending a few minutes with us this morning to tell us all about it.
All right. Well, thank you. I appreciate it.